My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk again.
Stress and investment.
And action. Hey everyone, Jennifer had a question about triglycerides. How to lower triglycerides. So if this is the first time you're finding me, before we get into this discussion, don't forget to hit the subscribe button down below, and there's an alert button somewhere to find out when I do new videos. So triglycerides. Triglycerides, for those of you who don't know or are younger than 20, usually triglycerides are checked in the cholesterol panel when we do risk factor analysis as far as blood tests in the doctor's office. From 20 years on, usually it's at 20 years, you get it every 20 years of age, you get a blood test every 5 years. Now, if you hit high risk like obesity, metabolic syndrome, or you've been diagnosed with high cholesterol, we'll probably check you every year. Or if you're on medicines and you're just starting out, every 3 months. Or if you're a diabetic, we have to really watch this. So bottom line is triglycerides can be a good marker as far as where we're going. It's a directional marker when we get it in the blood test to figure out if the changes that you're making are good or if the changes that you're making are bad, and if we have to get more aggressive with you. So if you subscribe to there are some people who don't believe or don't follow the cholesterol myth that lowering cholesterol decreases heart attack. And I think the old school information has to be taken into account. I think there's valid studies from way back when, although epidemiologic, I think they still are important. They cannot be ignored. There's also new studies that show we might want to take a different approach, but in looking at my patients, I think the bottom line is, can we get you to the best you as far as body mass index, nutritional practice, exercise, and stress busting? So if we are finding problems with high triglycerides in your bloodstream, over 80, let's just give you a little cushion, over 100, I think it's important to try to do your best to manipulate exercise, diet, stressful practice or stress busting, and better sleep to make that marker change, in addition to the LDL and total cholesterol and HDL. Now for this concept, because of Jenn's question, we'll just handle the triglycerides. So I think that it's important to know that I put a couple of options here as far as what can help with lowering triglycerides. I've actually also indicated it here. So when you eat fuel or food, it gets absorbed, it gets broken down in the stomach, turned from solid into liquid, and then in the small intestine, it's absorbed slowly. And those macronutrients that the solid fuel gets converted into will be absorbed as basically fats, carbohydrates, and proteins. Now the fats, or triglycerides, triglyceride is a form of fat, will usually be absorbed in the ileum, and the ileum is the last portion of the small intestine. Now, usually that's with mixing in with your bile. That's what bile is good for. Everybody remembers bile as being, you throw up bile, it's greenish, but actually it breaks down fat and it makes it easily absorbable. So a problem could be, if you have high triglycerides, the first thing I would say is you want to make sure that that fasting blood test that you got is 12 hours. I bet you a lot of my patients don't do a 12-hour fast. And I think there's enough data that says that if you have a meal at night, say 8 o'clock, and then you go in to get your blood tested at 7, technically that's not a 12-hour fast. And anything less than 12 hours could technically still be the chylomicron sitting around in your bloodstream that got absorbed from the night before. Again, it's an argument, and usually when you absorb, as I was alluding to, the fuel in the terminal ileum, it is transported from the bloodstream of the small intestine into the liver and to the rest of the body via chylomicrons. Chylomicrons are the transport buses in the bloodstream for triglycerides. And if you have a big meal, you have a lot of chylomicrons, you can potentially have a huge triglyceride surge in the blood test the next day. So I really think that you should fast for 12 hours, only water. Now, coffee in the morning can jack up, in theory, your triglycerides because of its effect on adenosine, and it's a stimulant of sorts. But most importantly, first off, if you keep on getting high triglycerides, make sure you fast for 12 or more hours. I think that would be more accurate. Number two, I would always want to, if you do have documented high triglycerides, I've put a couple other things here. I think I'll just switch over to my big board. If you do have high triglycerides and the blood tests are accurate, and say you're on medicines, you're diabetic, you're on cholesterol medicines, and you're on diet or medicines for diabetes, I would try to do natural things to lower triglycerides. And the first thing is exercise. Exercise works to lower triglycerides and improve HDL by increasing something called lipoprotein lipase. Lipoprotein lipase is the enzyme that breaks fat down and starts to liberate triglycerides into the bloodstream. When you start breaking things down, the fat in fat, I should say the triglycerides in fat, the triglycerides in muscle, you will actually eat up more of the triglycerides. So that's why exercise is really good. The other thing that exercise does by increasing lipoprotein lipase is it decreases all those cells, or those carrier proteins, those carrier micelles that I mentioned after eating in the bloodstream. The chylomicrons and the VLDL, or very low density lipoproteins. And if you lower them, you have less triglycerides. So exercise. And I usually push to 90 minutes, at the least 90 minutes a week of moderate to intense exercise. Don't hurt yourself. I have other videos that you can check out down below as far as how to exercise or how to get to that threshold. The other thing to also take advantage of if you have problems with triglycerides is the total omega-3, TO3. Total omega-3 in several different studies, old school, but also new, and with the low side effects, has shown that it decreases, if you have it in your bloodstream and in your nutrition, your daily diet, it decreases lipogenesis, which is forming fat, beginning fat, constructing fat, lipogenesis, forming fat. If you decrease that lipogenesis property, you'll actually have less triglycerides. But the problem with total omega-3, usually found in fish oil if you're not a vegetarian. If you're a vegetarian, you can get it in flax a bit, flaxseed oil or hemp oil, but it's just hard. It comes in ALA, and hopefully your body can convert ALA to its other properties to get total omega-3. But we, in an American diet, usually have way too much omega-6. So if you can balance your omega-6 that you have in your normal diet with omega-3, then the ratio, if you get higher omega-3 to omega-6, you'll have decreased triglycerides. The calculation is usually about 4 grams per day, and that's 2,000 milligrams, or 2 grams at a time. I don't think the gut can handle more than 2 grams of that omega-3 fish oil or flaxseed oil at a time. So, well, just for easy sense of nomenclature, just call it omega-3 fish oil, because everybody knows fish oil. Those of you who are vegan, vegetarian, will have to break it down into ALA and DHA, and it's complicated. In fact, I put a link to my old video on fish oil. I don't take the fish oil anymore. I'm more flax and algae-produced DHA. But for the sake of triglycerides, 4 grams per day, and divided 2 grams at night, 2 grams in the morning. Now, again, please watch the video I linked to down below to make sure that you're not just reading the number on the front of your bottle. It's got to be total omega-3. And total omega-3 equals EPA and DHA. So if you can get that in your diet, that will also help decrease lipogenesis and decrease your triglycerides. The other thing that also helps, I believe, is fiber. If you have enough fiber in your diet, and that could be a problem if you're a carnivore or you're in keto. Those of you who practice ketosis or nutritional ketosis, I think you can get vegetables in there, but typically fiber is associated with vegetarian diets. So try your best to get fiber, because I believe the way it works is if you have fiber in your diet, the bile acids that you secrete in the small intestine from the liver to break down fat, they have, actually, it's made up of cholesterol. But if you take the fiber and the bile acids in a nice proportion in your diet, you will actually poop out those potentially potential to be absorbed fatty acids, triglycerides out into the poop. So you'll notice that your poop will float more. You'll also notice a little bit of more bloating as you get used to the fiber. Definitely more gut irritation when you initiate omega-3 fat at that kind of dose. So be forgiving, do it slowly, and hope you can build up to the symptoms. Eventually your gut will like that, and you'll be able to deal with the pooping and the improvement in the bloat. But anytime you introduce any change in food, your gut microbiome will change. It has to react to it. So we also need a probiotic, by the way. You need good gut health to make all this stuff work. The final thing, aside from the fat and the fiber and the exercise, would be niacin. Niacin works well to decrease triglycerides in many different studies. The only problem is, out of everything here, niacin has the highest side effects because niacin seems to irritate the liver. And some of the preparations that we use in the medical clinic for niacin can actually cause, when combined with some of the statins, a liver backup. So we have to be able to be careful. Niacin in vitamin form does have a tendency to cause a flush. So that's usually a deal breaker with a lot of people, especially if you're hitting middle age and you're a female or perimenopausal. Now men can have hot flashes too, menopause, but niacin will speed that along. So you have to get a pretty decent brand of niacin, and it's supposed to be 4 grams a day. So I would probably divide the niacin into 2 grams twice a day, and to match the fish oil or the total omega-3 of 2 grams twice a day up here. So 2 grams twice a day here, 2 grams twice a day here. So I just have to know what kind of niacin and play around with it. Don't do both of these at the same time. I would do one first, see how your gut tolerates it, look for side effects, continue on, and add the second one. Whichever one you want to try first, it's up to you. And niacin is essentially a B vitamin, vitamin B3. So the other thing that is really a hot ticket now is ketosis. Ketosis, or the nutritional ketosis that a lot of keto followers are following now, seems to incorporate messing around with lipids. That would be total cholesterol, HDL, triglycerides, and LDL. We don't usually measure VLDL, and most insurances will not pay for that fractionated lipid panel where you're getting apoprotein measurements and small particle LDL, small particle. So I still say, since we're only trying to get directional corrections on lifestyle change, you can do the fancy one or you can do the cheap one, the standard one. But whichever one you do, you have to take the data and know what you're doing with your life and change so that the data will, and your weight and your risk factors will also change in the long run. If they don't change, I mean, the easiest thing to do out of all this is obviously changing your nutrition. The problem with triglycerides, as I think I have here, is the easiest thing to add or make your triglycerides go up would be candy, sugar. Sugar sweets equals triglycerides. So this I just picked up from Planet Fitness, a Tootsie Roll, and you believe it, eating a lot of sugar, whether it's in candy form, pastry form, or alcohol form, because alcohol is sugar, it will jack up your triglycerides. So you really have to, if you have triglyceride problems, you really should be pulling off that or decreasing it to the minimum. So sorry about that. Those are all the fun things, but there are other fun things you can take advantage of as far as food. But as I was alluding to, food will be, if you manipulate your nutrition, will be the first thing that you can do to drive that triglyceride level down. As far as going cold turkey, that's versus a little bit at a time, it's totally up to you. But I would say that's a big driver for problems. Alcohol, again, I just mentioned that. If you do have a triglyceride issue, limiting that or eliminating it would be important. There are some studies that show if you take alcohol with a very high protein meal, you might negate the effects of the sugar that you're taking in. But you'll have to play around with that one. I would say drive that triglyceride level down by being very diligent with your nutrition. When you know that you've maintained that for about 3 months to 6 months, then you can introduce a little bit at a time and see how much you're allowed to have before your blood levels are impacted. And usually that's going to be self-experimentation if your doctor is willing to do it as far as blood testing. Dave Feldman is a great self-experimenter, so interesting information from him. Finally, the other thing that you should keep in mind is that stress response will generate a lot of lipid, has an energy or fuel source. So when you're stressed out, you will jack up all markers, whether it's glucose or triglycerides, because your body's getting ready for fight or flight, so it has to have active fuel. And you can use fat as fuel in the form of triglycerides, or you can use glucose as fuel in the form of your regular glucose. But either way, if you're constantly high stress and you've done all this other stuff, then nothing's happening, you have to do something with that stress response, and you have to get better sleep. And I think fasting and a modification of a mindful practice or meditation would be important. So you just have to add all these things together and maximize, put it together in a recipe for you, maximize on it, and then decrease your risk factors for disease later on. Don't be too frustrated, Jennifer. I think everybody has to find their way. No one can go cold turkey or go straight to vegetarian diets or go straight to ketosis diets. No one can go to a water fast. And you don't want to be taking a whole bunch of medicines and not doing anything with your health. So it's just a little, again, course direction. Hopefully this works for you. If any of you have issues that, or have found other herbs that have helped, red yeast rice, other forms of niacin, please put them down below so you can share. Otherwise, I will see you at the next Minute Clinic.